Right, in this segment I'm going to be talking about post-operative management for somebody that's had a total hip replacement. And in this case we're going to be talking about a left hip, and this is assuming somebody's had a hip replacement from the front, so an anterior hip replacement. The good thing about an anterior hip replacement is there's virtually no precautions. So I won't have to educate Heather as to any precautions whatsoever. We'll just talk about what to do in recovery, and then basically how we're going to manage her hip when she gets back to the ward. So Heather, the very first thing that I want you to prioritise with is your breathing and inflating your lungs. So if they will allow you in recovery, I'd like you to bring the bed up as much as you can. Your lungs will certainly work more effectively if you're sitting up straight. And as I said to you, I'm not too worried about how flexed Heather's hip is going to be following an anterior hip replacement. So Heather, let's just start with some deep breathing exercises, lifting your arms in the air. I want you to lift your arms right up into the air with a deep breath through your nose. Just hold it for the count of 3. And breathing out. And it's really important to expand your lungs as much as you can. Lots of little bits is always a better option than just doing one load once a day. So I'd encourage you to take 5 deep breaths with a 3-second hold, lifting your arms up in the air every hour. Obviously, if you can't lift your arms in the air, you can lift 1, or you can even do it without. That's excellent. All right, Heather, I'd also like you just to move your ankles up and down. Just pump your ankles up and down 20 times just to promote circulation. And obviously we want to prevent any blood clots following surgery. And once again, this is the sort of thing that can be done on an hourly basis. And really, if you just concentrate on those 2 things in recovery, you're already 1 step ahead of the game. A little tip about how to rest in bed after a hip replacement. I'm just going to bring you back down. It's generally quite comfortable to have the knee bent when you're lying in bed. Bending the knee just softens the hip a little bit, and obviously you're not going to get out of bed in this position, but it's certainly a nice comfortable resting position. A hip replacement's not the sort of operation you can really lie on either side, so you're really dependent to lying on your back, and you might as well be as comfortable as you can. So my recommendation is knee slightly bent, and that'll put the hip in a nice gentle flex position in bed.